Hello friends, I am Homeopath R.S. Sani. Today we will make a video explaining the difference between rubrics. We are going to take 4 rubrics which cover 2 remedies. First I will speak about the rubrics, then I'll explain each one of them, and then the 2 remedies which are common amongst these rubrics, the commonality and the points of difference in the 2 remedies will then be explained. I hope this video will help you do the differential amongst the remedies which we see in our clinical practices daily, and it helps us to select the one out of the 2. The rubrics are anticipation ailments from, disturbed averse to being, embarrassed ailments from, or embarrassment aggravates ailments from, and fear ordeal of N. These are the 4 rubrics which are having common remedies: Gelsemium and Arnica montana. Both these remedies belong to the plant kingdom. Before going to the differentials of the remedies, let me in brief explain the meaning of the rubrics which I have already detailed out. First rubric, anticipation ailments from. Under this rubric, those patients are categorized or grouped who, before the happening of a particular event, they get disturbed, they get anxious, the anticipatory anxiety about an event or about a work, about a task, about a performance, or any other such situation where the person feels that something is expected from me and I have to carry the work out in such a way so that others get the maximum benefit out of it, or others are expecting me to reach at a certain point of time at a particular place and I shouldn't be late, where there's an engagement which is already fixed or an appointment which is already scheduled. That creates an anxiety, an anticipatory anxiety into the person, and we apply this rubric, ailments from anticipation in such situations. The second rubric is disturbed averse to being. What is disturbance? Disturbance is when something is going on smoothly and in the course of doing that work or that task or that activity in a smooth manner, something comes and interrupts it midway or at the beginning or at any point of doing that particular activity. So this is a reality check for the person who feels disturbed. The person wants all activities or the one which is in hand and he is or she is doing it, it should go without any interruption. Doing the job, doing the work, doing the task, carrying out their duties in an uninterrupted way is not feeling disturbed. Once there is some interruption or disturbance, the person feels bad about it. So we apply this rubric where the disturbance is caused in smooth functioning of any activity. The sickness, the problem, the discomforts during disease which are experienced by the patient can also disturb him because his regular and smooth activity is being affected by the disease or the disease process. The third rubric is embarrassment ailments from. What is embarrassment? Embarrassment is feeling bad, feeling unpleasant, feeling awkward in certain situations. Such embarrassed situations can be like, for example, someone is suffering with eczema, psoriasis, or any other skin rash or skin disease which is visible onto the exposed surfaces of the skin. For example, the face, the arms, or any other such limb of the body which is exposed. The person feels it very bad to expose himself or to go to the public settings in group activity, etc. The sufferer feels very bad to present himself or herself in such public settings. The group activity also gets affected when the person feels that what others will think about me. I don't feel presentable in this skin condition of mine or in this diseased state of mine. So, this feeling of embarrassment restricts the person and he feels bad about it while he is in certain such social setups where he cannot bear this discomfort being seen by others. So, this embarrassment causes him low feeling also in certain situations. The fourth rubric is fear of an ordeal. So, what is an ordeal? An ordeal is a discomforted or bad time or an experience which the person has already gone through in the past. It can be a disease, it can be any experience also. For example, a person who have had asthma in the past and it was treated maybe with conventional medicines or with the use of puffers or bronchodilators. The problem vanished for some time and now it has reappeared. The patient felt very disturbed and affected by this disease in the past, and now when the symptoms have started coming again, the patient says to the doctor, Doctor, I I fear that the same kind of sickness, the same level of sickness which I experienced in the past should not be faced by me now when it is coming up again. So, the same ordeal which the patient has gone through, he or she does not want it to be repeated in his or her life. These four rubrics, when we repertorize them by putting them together, they exhibit two remedies in common. One is Gelsemium sempervirens and another is Arnica montana. Both these remedies belong to the plant kingdom. As you know, plants are very sensitive and very susceptible. So both these remedies have their sensitivities and susceptibilities in different ways and different degrees. So far as Gelsemium is concerned, Gelsemium is a remedy which has low self-confidence. Gelsemium is a remedy which feels and fears failure. Gelsemium is a remedy which gets affected during such situations which are full of excitement. Gelsemium is indicated where the person feels that I am unable to perform. I cannot show my worth in any given situation. Gelsemium's rubric, will muscles refuse to obey the will when attention is turned away, guides us to the essence of this remedy. For example, there are patients whom you might have heard saying, Doctor, I want to go to my work every day in the morning, my mind tells me to get up, get ready, and get going to the work, or an athlete who goes to the track daily for a few days, he or she is feeling that my mind tells me to get up early in the morning and go for the trials, for the training. But what I see is I try to get up, I muster my courage, and I do get up in time. I try to get down from the bed. When I start to put my shoes on and I am trying my laces, my body says, "Oh, I feel lethargic. I do not want to walk and go out of the home." The mind is saying, "Go, get up," but the body refuses to obey. So, in this condition, we apply this rubric that the will of the mind is filled by the muscles. The body does not rise up in response to the command of the mind. There is total incoordination of muscles and the mind. So Gelsemium feels totally a kind of paralysis, prostration, and torpor. The patient wants to lie down, doesn't want to get up. Though the courage is mustered to get up, but the body says, "No, I cannot go along with your command." So Gelsemium is a remedy which leads to slow paralysis, slow paralysis, slowness of the body, slowness of the system. There is a lot of trembling in anticipation in Gelsemium patients. And in order to feel a little better or positive in that situation, the Gelsemium patient has a tendency to cling to any support which is around him or her. If the Gelsemium patient is a child, he will be very much attached to the mother. He will immediately cling to the mother, seeking her support and assurance. Gelsemiums feel very traumatic. They are so afraid in any situation that they do not want to be alone, separate, and independent because they want support all the time in such situations. Gelsemium feels so powerless that they have a fear of falling. If a Gelsemium patient is going downstairs or upstairs, he will catch hold of the rails because he fears that he will stagger and he might fall down. Similarly, Gelsemium patients have a great fear of going in the elevator, especially when the elevator is going downwards. So Gelsemium is such a remedy which is very fearful and very afraid and wants assurance and has a clinging character in order to seek support and feel secure and safe. Arnica, on the other hand, is a remedy which does not allow anyone to come near him or her during the state of sickness. Arnica fears hurt, fears being injured. Arnica does not allow anyone to touch him or her. For example, if there is any wound anywhere on the body, the patient will not allow the doctor or the attendant to touch the area where that wound is appearing. At the back of mind of the Arnica patient is a big hurt, a fear of being hurt, a fear of being injured. That is why in our repertory, we have rubrics: fear approaching of people, fear approaching of objects. And in order that they should not be approached, they should not be touched during sickness, they only declare that we are well. Nothing has happened to us. Arnica will say, if the doctor wants to help him, doctor, go your home, go away. I don't need your services. I feel well. So why Arnica patients declare they are well, or why do they say well during a state of sickness even? The idea at the back of mind is a fear of being hurt. Because if the doctor comes to help them or any other body wants to give any kind of help in their sufferings, the Arnica patient fears the very touch, fears the very approach. Arnica patients feel that my suffering will increase rather than there is any help which I will be getting. So, the fear of hurt is the guiding point in the selection of Arnica. Gelsemium, on the other hand, would like to cling to the persons for security and safety in situations of fear. And these two remedies have their mentalities totally different from each other. I am hopeful that after listening to this video and the differentials of these two remedies and the explanation of the rubrics would help you in your practice in your clinics. Please subscribe to my channel so that whenever I make such videos, such segments which really help you advance in your clinical practice, the information comes to your inbox and you get the notifications and you derive the benefits out of it. Thank you very much for listening.